this is Dr. Laura Hockman. I am the CEO and founder of Happy Day Health, where I help to match awesome physician-owned practices with some really wonderful physicians. And I'm also the host of the Private Practice 101 conference, where we will be showing doctors how to open their own practices, or if you're even just curious, what it takes to open a practice. And actually, come to think of it, if you already have a private practice, there's always something you can learn. So this week we are highlighting some of the speakers, and today we have Dr. Grace Torres-Hodges here. Tell us a little bit about yourself, Dr. Torres-Hodges.
First off, thank you for having me on here. I appreciate also the invite to I'm actually a panelist, not speaking, at the upcoming SoMe Docs conference. And so the panel will be 4 of us on the final day, which basically I always think of it almost like a cleanup spot. So like a cleanup hitter type thing. So I've been in private practice. I'm a podiatrist and surgeon in Pensacola, Florida. I've had a solo practice since 2001. I do full scope podiatry from conservative to surgical. I have full range of patient demographics from infants all the way to their grandparents and seniors. My mission these days is number 1, to take care of my patients, and number 2, to educate both my colleagues and also other, just the community in general, about the importance of the independent private practice. I authored a book called Private Practice Solution. If you allow me to plug a little bit, it's called Private Practice Solution, Reclaiming Physician Autonomy and Restoring the Doctor-Patient Relationship. It helps with mindset of entrepreneurship, and also particularly I have moved my practice from insurance-based all the way to direct care. So I've seen the gamut of everything. After being in almost 25 years of practice, I've experienced both solo and group, mobile, timeshare, and private office. Independent contractor is a private office. I've been in insurance. I've been in direct care. I volunteer as a private practice. I deal with all ages, medicine and surgery, and I'm a mom. And so I have a life outside of here. So I hope by participating in the panel, I can offer some advice to newbies and seasoned doctors. And I'm a second generation doc. My parents were both physicians, and I've been very blessed to have them as inspiration for me. My mom's an internist, retired. My dad's a general surgeon, retired. I worked as free labor in their office, so I learned a lot of the stuff about entrepreneurship, running a private practice in the heyday of medicine before managed care. And I always intended to go into private practice, so it wasn't anything that was really new. As I teach residents over the last 20 years, there's been a huge shift. People are swaying away from it. They did for a while. And then now it's coming back. So it's kind of fun. It's like, they say everything comes around again. So that's my thing. I'm here in Florida and enjoying it.
That's awesome. Thank you. And you know what? I'm going to share the link to the conference here in the comments. Now, if it doesn't show up, there you go. It's posting. If it doesn't show up, depending on some of the platforms will post my comments here and some won't. So if it doesn't, I'll just go ahead after we chat to link the comments. It's also in the description. So I'd love everyone watching to please go sign up, share it with your friends. You not only do you have nothing to lose, but you have a lot to gain. So definitely come check it out. So were you straight from training? Did you go to private practice, or did you join some sort of group? Like what was your story to go into?
So my story was after residency. I actually joined, I originally was going to open up solo. And I'm coming back to my hometown. I thought, I can handle it. I can deal with it. I understand the business. My parents wanted me to join their practice, and I'm like, no, I can't. I can't do that. I have to make my own. I have to make my own name, because you want to do that on your own. I actually joined a group practice with another group here in town. Unfortunately, we didn't see things eye to eye. A lot of it had to do with I got pregnant during that time also. So,
How dare
uh,
you? You're so
so,
selfish.
you know, so long story short, I think things happen for a reason, and it was a blessing in disguise. Um, when you go into a partnership or a group practice, it's almost like dating in a marriage. You better be past the dating stage already, because it's got to work. Because not only do you have to see things clinically the same, you have to see things running the business the same. If anything, I learned that early on, after a year in that practice. Then I opened up on my own and, started like everybody else, got on, I was on all the insurance plans and everything. And things were running pretty smooth till about 2010, 2011. We started getting a lot more quality care things, particularly with Medicare, and a lot more of the business aspects and administration changed. When you're getting out of school and when you're getting mentored by the see one, do one, teach one method that we all grew up with, you listen to what the others ahead of you did. And they said, well, you got to get on insurance plans or they can't find you, you won't get paid. But they also say, hire someone to handle the business end of your practice. And unfortunately, as the years went on, that really changed a lot. And the business grew around doctors. We were wanting to focus in on our patient, but the business grew around it. And it's things that were never taught in school. And so I have my MBA also. I actually got it after I went and started mentoring other doctors because I wanted to learn the pedagogy of how to explain it to people. And a lot of my book goes through a lot of basic things that in the end, what was interesting was that every doctor has it in them to be a private practice owner if they choose to be. First off, it's always by choice. But more importantly, if they doubt themselves that they don't have the skills to run and manage a practice, they have to realize that every patient that walks into their exam room is a small business that they're managing with all the different organ systems and managing the complexities of balancing ins and outs is the same as finance. When you're trying to do marketing, you're trying to explain your treatment protocol and you want them to buy into it, So there's a lot of that is very similar that I think sometimes we just have to remind ourselves about it.
Yeah, that's true. I see a lot of doctors who are like, well, I don't know how to run a practice, so I can't open a practice. But I think, you're teaching doctors how to run their own practices.
Yeah, exactly. And it's just it's really more helping them find themselves in it. But and I always also preface it in saying private practice isn't for everybody. You don't go into this thinking that once it's a one and done thing, it's a constant thing. So, it really depends upon your personality. It depends upon how much you want to put into it, and how much you expect to get out of it also. So I'm really happy though with the fact that I love this format that we're coming with the private practice conference. I think it's important. The earlier that this can get incorporated, the better also. So not only to seasoned doctors, new doctors, residents, and even medical students, they can learn so much from this. And a lot of these, again, cross over to regular industries, other industries too. We learn from them, they can learn from us. So
That's very true. Yeah, I mean, we really don't get a business education. And something you said earlier about partnership, which I think is interesting. When I'm matching physicians with practices, a lot of what I'm doing is trying to think, will this physician match not just clinically and personality and
right.
culturally, but in the partnership track practices, will they match in the business running of the business? And what's interesting is a lot of doctors, which I totally understand, they say, well, is partnership offered and how do I get there? And I think a part of it is not realizing, what if you don't agree with each other on how to run the business?
And
Um,
that was what I found, you know, I think a lot of times when you get, particularly like with a panel discussion or just even in with the speakers that we have lined up and everything, we all went through mistakes. And that was a big one that I went through. I did not realize, because you always just think the simple things. We've been so sheltered during our residency that you do, you know, there's another world out there also. And then you'd like to think that with your own folks that they would take care of it, but it's not always the same. So
yeah.
I totally agree with you on that. Yeah.
Yeah. I think there's a lot more to partnership than we realize. And even thinking back, when I was a relatively new grad, a few years out, and I joined a private practice, and I was like, well, why is partnership not offered? Like I want to be a partner, but when I really think about it, I didn't want to be a partner. I didn't want to run a business. I wanted to
It
stay.
sounds like
I
it.
like, I wanted to have a voice, which, that would have been nice too.
Right.
Um, but it was more so, I think, that I wanted to have a voice than I wanted to run a business. I don't want to run a business. I wanted to say, hey, here's this great idea to make us more profitable. Why
Right.
don't I spearhead the project?
Right. Right.
But the actual running of the business, mm-mm.
And that's a big, and that's the big thing when it comes to the entrepreneur component of it, owner of a private practice. It's great if you have the drive to do that. It's also fantastic as an owner. I want folks that want to help me grow.
Exactly.
So it may not be necessarily needing to be like you said, being the same level. You need
Mhm.
everybody working together. So.
Right.
Mhm.
Right. And exactly. And if you were to hire someone, you don't want someone who's just what's in it for me. It's more like, how can I help you as a practice?
Right, right.
So anyone watching who's looking for a job, I'm just
Just
hinting
say,
here. I'm just saying it's not about what they do for you. It's what you do for them.
and even my kids, when I was help them during summer trying to get jobs, that's the thing. You make yourself valuable, and I think one of the things that we'll probably find throughout the entire conference also is when you see physician owners, that's one of the things you have to find your unique selling proposal and what makes you valuable to that other individual, because we're nothing without our patients. When you
Mhm.
think about it, it's great, we've got all this stuff in our head, we can do these things with our hands, but if we're not able to relay that to our patient, it's all good, but you're not going to get paid.
Exactly. Right. If you can't get yourself patients,
Actually. Yeah. Yep.
a
Yep.
practice isn't going to want to pay you if you're not bringing in the money for them to pay you.
Right, exactly.
Yeah,
So,
exactly.
but anyway, yeah.
Well, I'm really looking forward to the panel. I think you have so much to share, and my hope, maybe I'll do a little preview and ask you a few questions now, but my hope is that people ask you, you're a mom, like, what was it like starting a practice as a mom? Some of the discussions before, some of the lectures before the topic are on finances and family and managing work-life balance and all of that. And so, this is kind of an opportunity for everyone to really dig deep. There's the Facebook group where they can ask questions and you'll be there to answer
Exactly.
them as well. But to really get questions answered, I'm going to just go right ahead and ask, how did you manage? You're an empty nester. So, how did you manage
When
owning a practice and having a family life?
So yeah, number one, I thank God, because I was whatchamacallit, I was very blessed. I have a very supportive husband, and so I think Dr. Stockwell was with you. She talks about relationships, and it's fantastic. Her thing's going to be great. Also, it's so important to have that support system. You need to have that. When I left the group that I was in, I was beginning my third trimester. And so I started my practice in October, and I delivered 1 month early in January. And I was out for, I actually got put on bed rest right around Christmas time. And then, so I was out an unexpected 8 weeks
Oh,
in my own practice.
oh,
And so financially, how do you handle that? I had left the group practice. And gone into my own. You financially have to prepare for worst case scenarios. That is probably one of the worst case scenarios. But I always try to make a relationship with the patient to start with. So from October to December until I went on bed rest, I was very fortunate. I had people come in. I think what I offered was something that they really valued, and they stayed with me. They were fine. My nurse triaged everybody and I was doing this by phone. This is pre-internet stuff. So we didn't have Zoom yet. And so I was able to manage, and fortunately I could sneak away. I'd bring my back room in my office even today is my old nursery. So once I came back to work, I was nursing between patients. And to be honest with you, I don't know if you ask my kids who are both in college, I think a lot of their personality is the fact that they grew up in the office in the back and they met all the patients also. So, it assured a lot of patients because they saw that there was life outside of medicine for me too. And yeah, you just make it work. There's no other
That's
way.
fun. Yeah, I have one of my kids who I'm surprised hasn't jumped in here. I luckily a lot of my clients are pediatricians because she'll often just come sit on my lap while I'm chatting with them, and I'm like, well, sorry.
I
Yeah.
had one patient actually put my daughter to sleep while I was working because so in podiatry I work on their feet. They're seated in a chair that's reclined, and so I had her holding my daughter while I worked on her feet, and then we exchanged afterwards, and then that was it. So and then I put her down to bed. Once they got into toddling ages, they went to daycare. But my husband balanced also. He works for himself, so he was able to kind of balance the timing of it. I didn't want to miss any of my kids' activities. I'll attribute it to my folks. My parents made it a point to make it to our activities. I kind of followed a lot of what they did. They didn't have that opportunity until they were in private practice, which was interesting.
Yes.
When they were both employed, it was a lot more difficult. But once they were in private practice, they made it to all of our things.
Yes, another reason, everyone watching, to start your own practice, you have that flexibility. One of the practices that I don't work with anymore, I found them an amazing doctor, but they opened their practice really close to the public school, so that, and then what they did was they adjusted their lunchtime around their kids' lunch times.
Oh, that's awesome.
And they could go have lunch with their kids every now and then. How fun is that?
Well, the same thing with vacations. You can plan your vacations around your kids' vacations. So yeah, there's a lot of little perks when you're
your own boss. Exactly.
Yeah. So yeah, I think we're going to get into a lot of interesting things. Panel discussions are always cool because you just never know what's coming.
Yeah. I'm excited. I feel like we have so much to learn from you. And what's kind of cool is you started taking insurance and then you transitioned into direct care, correct?
That's correct. Mm-hmm.
How was that transition?
15 years in the traditional insurance.
And this was really before direct care was a big thing. So you were
there was it was around. The primary care docs were there. I went to DPC conferences constantly to learn. And then there would be like small groups of specialists there. What's happened within probably just the last 5 years, DSC, direct specialty care, is really a new term. And it was always mixed up with concierge, which is completely different.
Yeah.
I learned from the other docs, but it was very early on. I mean, 2013, it was right around when the Affordable Care Act was being enacted. There were a series of conferences around the country that were like one-day seminars that were how to thrive, not just survive, with the upcoming changes. And because it really became a lot of minutia when we started to work on it, particularly if you were involved with Medicare. That's the big beast. And so, but one of the things that I always, that I tell people, both physicians and patients alike, I'm not anti-insurance. Okay. I just don't think they're good stewards of our money. is what
No.
it comes down
Yeah.
to. And there are other plans than just the standard ones that you hear about, what many call the BUCAs, the Blue Cross, United, Cigna, Humana, Aetna. So, I think I mixed it up, but yeah, those are your standard ones. But there are a lot of health sharing ministries. There are a lot of other self-insured and direct reimbursement plans. Yeah, but there's a whole ecosystem that's outside of what this conference is going to be talking about. But I think you need to be aware of it. And so, yeah,
Yeah.
so
No, that's true. And we do go over, we have a lecture on billing
right.
practices and
Mhm.
personal finances, and one lecture on personal finances, one lecture on business finances, which
Personal
will be
finance
great.
is very, very important.
Yeah, so
Because if
important.
you're not, it comes around with the same thing with just you as a person. If you're not settled and confident with yourself, there's no way that you can be able to help others. So
Hmm.
if your personal finances aren't in place, it makes it difficult to grow from that point. So
Right,
yeah,
right. And then you end up doing things you don't want to do because you get
exactly.
kind of desperate. So
Right.
yeah, no, I hear you. If you
I
could
think
go back in time, let's say to when you were
and get rid
starting
of
your
gray
practice.
hair and other things like
I
that.
know. Well,
so,
showing my age here.
yeah. But if I go
Um,
back in time,
if you could go back in time to when you started your practice, what would you
mhm,
tell yourself?
set boundaries and pay yourself.
Oh, pay yourself. That's a
Yeah,
good
you
one.
think you're like this like stoic person,
Yeah,
that everything goes to the business, but
right.
make sure that you're paying yourself also because you're employed by your business. And so I would always sacrifice for my business at
Yes.
first. And my husband reminded me of that. He was my office manager. He goes, you need to pay yourself. I'm like, okay, okay. No, but we need to buy this equipment first. Like, no, you need to pay yourself, but
Right.
also setting boundaries, learn to say no, know what you can take care of. I think boundaries is always going to be the big one. um, Boundaries of paying yourself, so that
Hmm.
also falls into it, but
Well, and that really comes in, the boundaries comes in when you're taking all of your own call, which you don't
mhm,
have to, but if you can set those boundaries with your patients in a, obviously a good, respectful way,
mhm.
it's actually easier to take call 24/7, 365 rather than,
People
um,
always ask, my father used to give his cell phone to all of his surgery patients post-op, particularly obviously if they had a complication. There's a reassurance there that patients have, knowing that I still do that, and I know a lot of other doctors say, I can't believe you do that. I do. I think the way that I've only had it abused twice, and there's this thing called block. So you can do that. But the relationship, by the time they're coming in for surgery and we discuss surgery, I've already developed a relationship with them. And so I have no problem giving my phone number to them. And it's reassuring. And, the way that you want to be treated by your doctor, it's that golden rule of trying to follow the same.
yeah.
Mhm.
And I see that in, my husband has his own practice. He takes all of his own call, except when we're somewhere that has no cell phone signal. So if we're traveling to like a very remote, middle of nowhere village,
Right.
he'll have someone else cover. But what's interesting is that he gets less calls in a year
Hmm.
than I do in a week when I'm covering for other people.
I believe it.
And it's all about, I mean, okay, he gets like one or two calls a year because he has that relationship with his patients. They're always kind of tucked in for anything.
Right.
So I think those boundaries are extremely important, and putting that in with the relationship you have with your patients, like you said,
Mhm.
they get it.
Exactly, exactly. The boundaries one I'm still working on because texting has really changed boundaries a little bit. I have to remind myself that I am on call, as Dr. Grace in this period of time. If they text me at 12 midnight, don't answer that yet.
Hmm.
Wait till the next day because
Right.
realistically, that's probably one of those that impulse texts that I just need to write that down. I
Right.
definitely do that with emails now, but texting is the hard one because I'm constantly looking at my phone. So
That's hard because you can't really avoid a text. Actually, what I have with my non-clinical business
mhm.
is my texts go to my email.
Yeah, yeah,
So when I'm asleep, I'm asleep. When
yeah.
I'm not
That's
working, I don't get them. And I'm just check.
I will learn from you.
I also have someone check my emails for me, so if it was
Even better.
urgent, she would let me know.
But yeah, so
That's
this will
great.
be good.
I'm so excited to have you join us as a panelist. Definitely check out, if you're watching, Private Practice 101 through SomiDocs. The link is in the description. I'm going to go post it in the comments if it's not there already. And I'm excited. Dr. Grace Torres-Hodges is one of our panelists who will be there to answer questions. I would love to see you all there. There's going to be some pretty cool prizes. We're going to have raffles. We're going to have, all sorts of fun stuff. So come check it out. And I'm excited to see you. Thank you so much for joining us today and for joining us this coming weekend for the conference.
Oh, I'm looking forward to it. I hope to see everybody there.
Go sign up.